So my presentation is on syphilis. My name is Joanne Fumivong. Okay, 1. The public health problem. Why does this problem exist in this society? Well, the syphilitic sores that indicate a person is infected are often not painful, so they can go unnoticed by the individual, especially if the cankers are internal. It can cause permanent damage if the penicillin or antibiotic treatment is delayed, and the latent third stage of the infection is asymptomatic. So, how does this disease happen? This bacterial infection is spread through direct contact with the syphilitic sores. They can be found in the rectum, vagina, mouth, around the anus, and on the outside of the body on the genitals. Transmission can occur during sexual intercourse and through congenital transmission, so through a pregnant mother giving it to her unborn child. Where does this disease occur? Some communities may have a higher syphilis infection rate, such as communities with a higher MSM population. MSM means men who have sex with men. It is also common in the southwest of the United States, New York, as well as some states in the South, including Florida. It is also seen in high rates in Western Europe and China, but it is found all over the world. It is found in communities where they are not practicing safe sex. So what are the risks for the community in the future? Women who give the disease to their children may end up having stillborns, or children who are born with seizures, developmental delay, or children who die within infancy. If infected, the disease can affect the nervous system or eyes at any point, which can cause permanent damage. So what are/were the etiological factors? Well, there are more cases in men, blacks in America, and in communities with more MSM. However, more women and men who are heterosexual are becoming infected in recent years. This can be due to unsafe sexual practices, which is why a concurrent infection of HIV can be noted. So how to solve the problem? 2 strategies. Strategy 1 would be to create a sexual education curriculum which is geared toward non-heterosexual individuals, so homosexual or bisexual individuals, and this sexual education should stress the importance of safe sex practices, so the use of condoms and dental dams. Another strategy would be easier access to sexual health services such as screening and free or affordable sexual protection, so just giving out condoms or condoms for cheap. And an example in the world would be how in the 1950s, China decreased their rates of syphilis dramatically through empiric penicillin treatment for high-risk populations, and they also tried to disrupt the commercial sex industry. Another example would be the Los Angeles County Sexually Transmitted Diseases Program created a program to control syphilis for incarcerated MSM, and the program consisted of screening, education, treatment, and detection of risky behavior. So a group of MSM who voluntarily joined this group was singled out and was treated separately from the rest of the prison population. Public health in the future. To prevent the reoccurrence of the syphilis issue, we would need enhanced screening for at-risk and pregnant women or at-risk population, and services for the affected patient's partners, which means once someone is found to be infected, they would need to notify their sexual partners that they could be at risk and have their partners screened and possibly treated, which prevents the same person being infected multiple times from the same person. So there should also be programs which link HIV and syphilis prevention, because the same population of MSM could have spread both diseases. And condoms should be made available in prisons, as we saw in the last example. In my opinion, there needs to be increased screening for those who are at risk, and their doctors should be encouraging them to get tested if they are within that at-risk criteria. And to make the screening more effective, there should be affordable options for testing, like what is already implemented at Planned Parenthood. These are my references. Thank you.